we've had two groups at work. One has been the gold group, which has been high-level strategic, and the silver group, which has actually been working on a more practical level on a day-to-day basis. But essentially, what has happened is that it's brought all of our partners together, particularly within health and education, to identify what the problems are, how we can best deal with it. Was it school closures, as it was in the early part of the pandemic? Now we're moving to deep cleans, but it is really about getting everybody to work together so that they all know their place in the team and what they have to do.
So you think that Birmingham is well prepared for the future in terms of swine flu?
I think that Birmingham has done as much as anybody, particularly with our experience, because the pandemic unfortunately decided to seek us out in the first place, and I'm sure that we can help other local authorities in the rest of the country how we've dealt with the problems.
Exercise Aries is a business continuity exercise with a flu pandemic scenario, and what we're trying to do is ensure that all our officers have got arrangements in place to ensure that they can continue to deliver their services even when this swine flu emergency that we've currently got impacts on their services. And what I mean by impact on their services, if they have a lot of members of staff who are away sick or having to look after people, we want to make sure that we can continue to deliver the services to the people of Birmingham.
In general, how well prepared do you think we are for the swine flu pandemic?
The City Council is very well prepared for the swine flu pandemic. As I've said, we're doing a number of these exercise areas to ensure that we've got business continuity arrangements in place. We've got emergency response plans. We're doing a lot of training and exercising and working with our partner agencies.
The key things that the local authorities can learn from Birmingham are planning to make schools resilient, having clear plans for working with schools and head teachers around how we deal with outbreaks so that they are workable and effective and will run in schools, having clear plans and guidance for making social care resilient, training modules for social carers, and actually models of working across multi-agency partnerships and networks to make sure that we all do our bit. I think some of the other things they can learn from us is some of the areas where we ourselves have learned about having clarity from the start about who does what and what their role is, and also I think just in terms of resilience of staff, measures for caring for people who may be on duty 7 days a week for 9 or 10 or 11 weeks.
That's the lessons that others can learn from us. How about Birmingham City Council itself? How well prepared do you think that Birmingham is?
I think in terms of Birmingham's preparedness, we've got some good things in place. We've got some good things in place for the second wave. In terms of schools guidance, schools training, but I think we can always do more, and the things I think we can do better are look at staff rotas and staff capabilities, look at actually having a register of skills in place so that if we have lots of social care staff absence, we can pool social care staff, and also pooling staff and pooling skills across the independent sector as well as the City Council, and that will make us more resilient.